You're welcome to Health Check. My name is Nanama Anobempong, and we are here today at Dr. Agawal's Eye Hospital, and we are here with Dr. Seniaja, and we are going to talk about retinal diseases. Doctor, you're welcome.
Thank you, Nana.
So, tell us, what is a retina?
Retina is a thin lining at the back of the eye. It is the one that perceives the image. If you look at the camera, the film that you have in the camera can be directly compared to retina. It takes the image, and this image is taken to the brain through what we call optic nerve, and that is interpreted for somebody to see. In other words, if there is no retina, you can't perceive anything. So it's a very critical part. It works with many mechanisms, with electricals, biological, transforming images for the brain to be able to interpret exactly what you see.
Okay.
Yeah.
Okay. So please tell us, what are the major causes of retinal diseases?
Well, we can group retinal diseases in. First of all, retinal diseases are many, but the major one that I will mention, which cause a lot of blindness, are three. The first one is diabetic retinopathy. This is a disease that affects many people who have diabetes, and it's actually considered the first complication of diabetes, and is the third, sometimes the fourth leading cause of blindness currently.
Wow.
It's also related to the poor control of the disease. That is the number one. Then number two is sickle cell retinopathy.
Okay.
This is a disease that affects the retina when somebody actually has sickle cell. We see these more with the SC type than the other subtype of sickle cell. They have the morphology and the changes you find in the eye. It's quite similar to diabetes, but it can be more severe in some cases. So usually when we screen the patient, we are able to detect that early and treat them. Mm-hmm. And the last one is the retina detachment. Although the first two that I mentioned can also occur, retina detachment is more common with the elderly, who actually, the back of the eye, there is a gel, and when the gel collapses, it creates a tear, and that can cause what we call retina detachment. Okay. There are many other diseases. One of the reasons why retina has separated itself from all other eye specialties because the vast diseases that it encompasses. So you could see that we could do so much about the retina, unlike in the past where we thought retina was just a very simple disease. We know that it's the main cause of many diseases now. Yeah.
Okay. So can you go into a little bit, what are those retinal diseases? Just a little bit.
Yeah, let's take for instance diabetic retinopathy. Diabetic retinopathy actually causes severe vision loss, and it's by now WHO has recognized that as one of the top leading cause of blindness.
Wow.
Very simple. The blood vessels are the ones that are affected. Okay, just like anywhere in the kidney, you have blood vessels, but the eye blood vessels are so tiny and so sensitive that they get blocked very fast. And you know, diabetes is a disease of blood vessels. Okay, when your blood vessels actually clot. So when there's not enough blood supply to the eye tends to undergo many changes. One of them is new blood vessels, one of them is leakages, and one of them is traction, which causes retinal detachment. Very interesting enough, majority of these cases will end up in blindness because some of these patients will actually bleed. But the good thing about it is that when we detect those early, there are ways we are able to prevent that.
Okay.
So we advise all patients who have diabetes to come early for checkup, because you may not go through that long complicated surgery when it becomes very severe. We can do laser for you. But today we give injections. Yeah, we give injections that actually cause those blood vessels not to leak, cause those blood vessels not to grow new blood vessels, which is actually the complications of diabetes. Because when it goes beyond that, then we have a case where we have to carry out surgeries that will last for 5 hours and get very little vision. So we want to avoid that. But unfortunately, majority of the patients don't come to check because either they are not referred to the eye specialist, or they just tend to ignore the eye because they don't know that there's anything wrong, so they'll deal with the sugar. But we know strongly that the control of the sugar itself has an implication. So once you control the sugar, it's not only the kidney that will be fine, or the heart, also the eye will have less complication. So that is that. Then the second one is sickle cell. It's quite surprising the amount of sickle cell related eye complications we get here. Majority of them are SC, like I said. The SC type, some of them actually have problem with the eye before they notice that they are actually sickle cell. Because even the sickle cell, the blood flow to some areas are closed, just like the diabetes. But in this case, it's because the red blood cells sickles, so they are not able to go through the tiny blood vessels that are in the eye. This will lead to what we call supply of blood vessel to this part of the eye, and then encourage new blood vessels to start growing. New blood vessels are generally a response to healing, but we don't want it because it causes a lot of problems like bleeding and even detachment. So once again, the best approach is, if you have sickle cell and you know you are SC, just check, because your central vision will be very good and you may not have any problem until you bleed. So it's very important. And also again, people should check whether they have sickle cell or not. Then retinal detachment. In the past, we were just sending people outside the country for retinal detachment. Just to mention this, retina is a very detailed area of eye care, and it's not cheap. It's quite expensive, starting from the training to the setup. So for a long time, Ghana never had a center for retina surgery. Just some few people who were doing it. But the last 3-4 years, we've seen these centers coming up. So many people will not need to go to UK or India or anywhere. We do these surgeries here. But again, the earlier the better. That's the biggest thing. Yeah, signs that you have retinal detachment will be like a curtain, sudden curtain, flashes of light. Those are the signs that you know that you have retinal detachment. And once you come and we treat it, that one is either we do laser or we take you to theater. The outcomes are much better. Just like any disease, the earlier you come, the better. The healing is much, but if you leave it for a long time, then of course it brings out a lot of complications. Then sometimes you have to redo it, sometimes you have to go back because the eye contracts quite a lot, like because the eye tries to heal itself, right? So it's like when you cut yourself and you don't put stitches there, then you have a bigger scar. It's the same if you have retinal detachment. The eye wants to heal itself and cause a lot of problem. And when we go to theater, then the chances of good vision drops. But many people, of course, are not able to afford. Yeah. And unfortunately, it's an area that is so expensive that you can't say, oh, look, let's make it cheaper. Because the consumables, the aftercare, it's quite intensive. But what we have here, we actually, to be honest with you, like Agawa, for example, we have a very affordable rate that is comparative. Yeah, that affordable may not be affordable to somebody, sure, but if we compare it to what somebody would have paid traveling outside, it's much less. Yeah. The problem is many people don't know what is involved in the retina surgery, so they will think that it's very expensive. But in a real sense, is not what you get. We use the same thing, we use the same machine, we use the same thing, but of course the prices are much less than what you find outside. So those are the areas that I want to cover: the diabetic retinopathy, sickle cell retinopathy, and then retinal detachment on its own. Yeah.
For one of them, you mentioned about a curtain coming down over your eyes. What are the other ways it can affect your vision?
Well, when you have retinal detachment, one of them is particles floating in your eye. You see something like dust. One is a curtain, like somebody's pulling a curtain down or pulling a curtain from below going, or even from the side. It all depends on where the detachment starts from. Then you have flashes of light. Usually the flash of light starts first before the curtain. So many people will have flashes of light. That is harmless. Okay, but we advise the public, you don't know what is harmless. So you have to come to the hospital. And sometimes when there is an early tear, we could do laser to seal it so that it doesn't progress to become a big thing. So we advise people, when you have flashes, when you have floaters, we call it floaters, things floating in the eye, you just check. Just check. And when there is a need for us to treat with laser, that will be very easy. You don't even need to go to theater. We just put a laser to seal it. The laser, it's like a glue. We glue it, and when it's formed a scar, it's become firm. Yeah.
So you mentioned the treatment options being two that I heard. One was the laser and the other was surgery. Can you treat it with eye drops or any other form of medication?
Unfortunately, no. Not for all the diseases I've mentioned now. Okay, because they are at the back of the eye and they are pure surgical procedures. And that is why the training itself takes so long.
Sure. And
that's why it is so expensive generally compared to other diseases. It's not a condition where you can just put an eye drop. I'll be the happiest person, because instead of spending hours in theater, I'll just give you a drop. No, that's not possible. Yeah.
So what are your final words regarding retinal diseases, and what should people be made aware of in particular?
Number one, retinal diseases are now diagnosed, treated in Ghana. There's no need for anybody to travel out for retinal diseases. That's number one. Number two, any sign that I've mentioned now should prompt you to come to check. If you see any doctor in the periphery and you tend not to be happy, you can come to the retinal specialists. Yeah, Agawa here we have one. I think Kolebu, and then some places. Yeah, you can ask and people will tell you where the retinal specialists are, instead of waiting. That is very important, because the earlier the treatment, the better. Thank you very much.
Thank you so very much, Dr. Seniaja. So we have dealt with retinal diseases today. My name is Nanama Anobempong. Thank you for watching Health Check on GH Today. See you next week.